So, doctor, people really fear hip surgery or hip replacement surgery.
Yes.
When is the right time to do the surgery?
So we generally do a hip replacement on two factors. One, what grade of arthritis the patient is having on a radiograph and our investigation. If it is 3 and 4, we would generally ask them to undergo a hip replacement. At the same time, if they have severe pain and they cannot do even smallest things in their life, means their sleep is disturbed in the night because they cannot turn, they cannot get out of the bed because of pain, they cannot walk up and down the stairs because of pain, they cannot get into the car or a two-wheeler because of pain. These are something which really trouble the patient, and that is when we do a hip replacement.
So, post hip replacement, is it advisable to do exercise or even walking up the stairs, getting down the stairs?
A lot of people have a lot of anxiety saying that after a hip replacement, I will not be able to do any activity and I have to be restricted to certain things. This is absolutely a myth, I feel. Almost 90% of your daily activities can be done after hip replacement. Yes, after surgery, you need to have some amount of rest and exercises. But I think end of 6 weeks to 3 months, you will be able to do almost everything
As normal as possible.
normal as possible.
So, Dr. Ashok, how much has the hip surgery improved, I would say, in the last 10-15 years?
There's a drastic change in the way we do the hip replacement, the materials used in the replacement, our understanding of the human body in terms of hip joint, how it works while sitting, while standing, while running, all this have changed over a period of time. So in terms of material, the longevity of that implant, what we put inside, has improved to almost 20 to 25 years, which was only around 10 years. You have additional 50 to 100% increase in the longevity of these implants. And also the surgical techniques. Yes, now I do minimally invasive surgeries where I really don't have to cut too much into the joint, so you're preserving the muscles.
Yes.
Without cutting them. And nowadays we do what is called as direct anterior approach, where you do not cut the muscle, you just go inside the hip through the capsule and then do. So they recover very fast and they can get back to their
daily life as soon as possible.
Very early. And because we are not cutting through the muscles and all, the pain is also very less. Yes, there's a drastic improvement in.
Then what about the robotics that is now coming in?
I think robotics is going to take over, and yes, robotics plays a lot of role, especially in hip joint. That is because it takes up the curvature of your spine, it takes up your hip, it takes up your knees, and overall alignment, and what is the best position both in sitting and standing. It calculates and gives you an ideal positioning of putting your implants in a correct position for that patient. That means it is personalized for you, what is the best position. In terms of accuracy, means if I want to put a cup at 40 degrees, or it will exactly help me to put the cup.
Accurate.
So accurate. It is bone preserving. It will not remove bone too much. And whatever we are cutting is also very less. So in those terms, in terms of precision, accuracy, and in terms of personalization and recovery, I think robotics is the future.
So, Dr. Ashok, what are the do's and don'ts of hip replacement surgery?
I would say you don't have to restrict yourself from doing anything, but I would caution you, or we would caution patients not to do extreme movements, like in certain yoga exercises where they have to bend their hip to the extreme. So those are some things which you do not want. And because we want the lifespan of the implant to be for a very long time, though it is for 20 to 25 years, we want beyond that. So we would tell the patient not to squat or sit cross-legged, though it is not a contraindication to do that, but we wanted to
better safe than,
Yes, be safe. That's the only thing. But they can go for a trek, they can do cycling, they can go up and down the stairs. There's no restriction at all.
But you have to be a little more cautious.
Yes, I think any extreme movement, I think we don't want them to do that. to be cautious. That's it.
So, doctor, one question as an Indian parent,
Yes.
I wanted to ask is, when a child is born, we always do massage for the baby.
Yes.
So, how good or bad it is, especially on the legs?
I think massage is a very good way of toning up or warming up the muscle, and that helps in increasing the circulation. It's a very good way of keeping the child also calm. So that way it is very good for the overall body. But coming to the hip joints, a lot of us will bend the knees and hips to the abdomen. That's a very good exercise for the hip joint. Not only that, we generally carry our children. Traditionally, we used to carry
Yes.
our children one leg this side and the other leg other side on our waist. That is one of the best ways to develop the hip joint.
Oh, wow.
We are losing that tradition, thinking that this is an outdated and an odd way of carrying your children, and we start wrapping the hips in a single cloth. No, I don't think so. That's a good way. I think we should still continue. There's a reason why we do that, and we should continue that way.
That's a very interesting answer, and I think we forget a lot of our traditional methods,
Yes.
and or we're putting them in a crib and taking them, right?
No,
we're not carrying them.
Yes, it's not a great way at all.
So, rapid fire round.
Yes.
Walking or gym, which is good for hip?
Walking for mobility and gym for strength.
Obesity, biggest hip enemy, yes or no?
Yes, major cause.
Best age to consider hip replacement?
Any adult from 16, 18 to 100.
One habit, just one habit that protects hip for life.
Squatting and sitting cross-legged.
Wow. Okay. So I think, like, again coming back, you spoke about our traditional methods. Previously we would sit down and eat,
Yes.
or Indian bathrooms were like that. So all that, I think that time the hip problems were much lesser in adults.
Yes, in Asians, most of the Asians are used to squatting and sitting cross-legged. So that is why their hip problems are much less than what we see in the Western population. So that is one of the major reasons why we don't see much of hip problems in Asians.